Hey guys, just to follow up with what we've been looking at and reading this week, we're gonna talk about all the pictures that we have seen throughout the lecture. I really just want to make sure that you guys are comfortable with looking at sediments and what is in them. The first couple pictures we're going to look at come from the assignment, and then I've got a few extras after that. So our first picture, number 1, this is identified as a calcium carbonate crystal. This is the one that you would see in horses and rabbits. And they come in 2 different shapes. Sometimes you'll see them in these little circular, and sometimes they'll come in like these dumbbell shapes. But both of those are considered calcium carbonates. Number 2 is a calcium oxalate monohydrate. This comes from antifreeze toxicity or ethylene glycol. Usually by the time you see these crystals in the urine, it's a poor prognosis. You can also see these in a dumbbell shape as well. There aren't any on this picture, but generally you're looking for the fence post shape, which is this one. And also knowing that, yes, this is a calcium oxalate, but important to know it's a monohydrate. Our next picture is a calcium oxalate dihydrate. These are normally seen in dogs, and they're found in acidic urine. And they're identified by their X shape that's in the middle. This picture is a struvite or a triple phosphate. The coffin lid appearance is what gives this one away. It's found in alkaline urine and usually in a feline patient. Now that being said, that typically your calcium oxalate dihydrates are in dogs and struvites in cats, but knowing that it can happen in either species. Our next picture is a bilirubin crystal. So these guys aren't necessarily diagnostic, but if you find them, you might have a liver patient or an IMHA patient where they have bilirubin in their urine and it can form crystals. They're actually kind of pretty. They almost glow. Number 6 is a cysteine crystal. So this one has that hexagon shape and usually is found with renal dysfunction. I skipped number 7, sorry about that, but oh, you can't really see it. Well, anyways, that one was your amorphous phosphates or amorphous debris. Usually you find it in alkaline urine. Possible if you're seeing fragments of crystals like that, we want to think about our centrifuge speed and make sure we're not speeding it too fast or spinning it too fast. This picture is sperm. It is common and likely to find sperm in an intact male. The next 2 pictures are comparing red blood cells from fat droplets. So the key term in identifying a fat droplet is refractile. So these red blood cells, you can see their anatomy and a little bit of their central pallor, where you see here they're solid, and then you have these bright white where that's the area where they're refracting. When you're focusing on your microscope, maybe the other bubbles around it will refract it at different levels. This is a waxy cast. Likely at the end of the tubules is where it came from. If you have one that's more proximal in the tubules, they're granular and they tend to degenerate as the cast progresses through the tubules. But knowing that a cast looks like this and that it's a form of the tubules that are coming out. Our last one is squamous epithelial cells. We know this because of the rough edges. So here's another image of struvites. So we have 2 struvites hanging out here, and we know because of the coffin lid shape. And then there's a white blood cell here. And then knowing that these are all fat droplets, and They are not red blood cells. There's another white hanging up here in the top right corner. But looking at this refractile image that they show. So this is a stained sediment using SETI stain. So we have some white blood cells hanging out in here. And then all these little cocci bacteria as well. And then we have some of this, like, maybe it's mucus, it could be stain precipitate. But if you see something like this, then you can definitely compare like these tiny bacteria into the big whites. This image has a few red blood cells. There's one here, one here. I hope you can see the laser pointer. And then some rod bacteria. And then up here, a nice little struvite crystal hanging out. This image is another cast. This one looks more to be like a granular cast versus the last one, it was a waxy cast. And then here is a granular cast. This is more commonly what you might see, or you might just see little sections or fragments of the casts, but this just seems to be a more common one that you actually see in practice. This crystal is an ammonium biurate. This comes from liver disease, and we normally see this crystal in Dalmatians, and it comes in alkaline urine. And this can also form uroliths. Here is an example of a urolith. This is a triple phosphate, which is our most common urolith that we see in practice. And this one's kind of a fun one. So this is a silica urolith. The pH that you find in these can vary. This is a stock picture over to your left of what the stones actually look like. Over to the right was actually from one of my patients in practice, and we took an x-ray and found this pretty little star in its bladder. Later on we did a cystotomy, which is to cut into the bladder and remove and flush. And we pulled out one of these little guys, and it was beautiful. As far as what causes it, nobody really knows. We think probably diet. So some diet restrictions might be made to keep these from forming again. I can imagine they've got to be pretty painful. This image is, we want to go over our hematuria versus hemoglobinuria. So as we discussed in our questions, we want to centrifuge the sample to see which is which. So after centrifugation, we have the sample still red, so we know that this is hemoglobinuria. And here, all the red blood cells have settled, so we know that that's hematuria. So we did get some separation. And then our last slide is our refractometer. So we've been using this for our total proteins in class, which would be over to your left side. So if we were reading our total protein, we'd be at about 5. However, when we're working with urine, we use the same instrument, but we need to make sure that we're looking to the right side where we get our 1.000 and up. So this would be a 1.035 reading, or how we would call it 1035.